Hi everyone, I'm Dr. Kok, a neurologist working in Sunway Medical Center Velocity, Cheras. We recently had a case involving a 75-year-old lady who presented with severe stroke symptoms. She had a sudden onset of a severe weakness in her left arm and left leg and difficulty speaking. On assessment, we found that she couldn't move her right arm and right leg at all, and she had difficulty speaking. We immediately scanned her brain, and the scans show a big clot in one of the big artery in the right side of the brain. As she came very early and within the time window, we able to give her a thrombolytic solution called Altiplace to lyse the clot. This is followed by a successful thrombectomy, which is a procedure to remove the clot. Within hours, she responded very well to this treatment. She able to lift up her left arm and leg, and she able to be discharged home early from the hospital. Stroke is very common, and unfortunately, stroke remains the third most common cause of death in 2020 during the pandemic time. There are two types of stroke. One is the blockage type of stroke. Two is the bleeding type of stroke. Around 80% of the time, it is due to the blockage type of stroke. In this scenario, nowadays, we have very effective treatment for this type of stroke. One, we have a solution which acts as a clot buster called Thrombolysis. Two, a patient can undergo a procedure called Thrombectomy. Thrombectomy is a treatment to remove the clot. However, not all patients are suitable for this treatment. These treatments are very time sensitive. I would advise to come to the hospital as soon as possible after recognizing the stroke symptom. I would go as far as to say that you need to reach hospital within an hour after the stroke symptoms. With this treatment, you would stand the better chance for faster recovery and as well as living independently thereafter. In order to optimize your stroke recovery, I have two important advice. One, to recognize stroke symptoms, which are sudden onset of weakness, numbness, unable to speak, unable to see, and a sudden onset of a balance issue. Two, after recognizing these symptoms, you need to reach the hospital as soon as possible, as this treatment can only be given within certain time limit.